My main practice focus is on cataracts and older eye care. So I see, a lot of patients with cataracts. I see patients with diabetes who are coming in for diabetic screens, a lot of macular degeneration. We do have a subspecialist in our practice who focuses mostly on macular degeneration and diabetes. So if there's anything significant, we typically refer amongst the practice into our individual subspecialties. But generally, an older patient population with, cataracts is probably the most prevalent in our population. Well, I mean, typically, diabetes, at least in our country, has a high association with obesity. So we see a lot of patients who have diabetes, they're overweight, they have typically high blood pressure at the same time. So a lot of cardiovascular and systemic disease associated with those conditions. In our practice, I would say the top two are cataract and macular degeneration. Those are probably the main ones. And then glaucoma is probably third on that list.
Hmm.
We do see a lot of diabetics, but in our population, not a lot of diabetic retinopathy, not a lot of really advanced diabetics. We have a fairly well taken care of population, very different from when I was in residency and I was in an inner city in Memphis where we saw really bad diabetics at very early stages, early ages, even young diabetics in their 20s, 30s, 40s with really advanced diabetic retinopathy. We certainly see diabetic retinopathy here, but not at the same level. A lot of our patient population is fairly well taken care of. Well, I mean, your vision is precious, and of all of our senses, that's the one thing people don't want to lose. So, concerns if they do have a diagnosis of macular degeneration, am I going to go blind? That's always the first thought. That fear of going completely blind, and then we have to calm patients and tell them macular degeneration, most of it is, well managed, and obviously with the treatments that we have today, even patients who have the most advanced form of wet macular can actually maintain vision for many years, where in the past, once you got that diagnosis, you were pretty much going to be assured you were going to be legally blind. Most people don't understand that they're not going to be completely blind, like the lights going out blind. And thankfully, we don't see a lot of that. But obviously, with glaucoma, patients are concerned they're going to lose their vision. And the lights can go out with glaucoma if it's poorly controlled or not managed. And cataracts, obviously, is one thing where they have vision loss that impairs them in terms of their daily activities. But we're able to correct cataract by removing cataracts and having cataract surgery. We're able to restore vision. So that's one of the really nice things about what we do is patients with vision loss associated with diabetes or with cataracts, we're able to take out their cataracts and restore their vision many times to something that far exceeds their expectations.